Good evening, everyone. Welcome to another session of Leadership Rounds, where we are interacting with the great leaders in the healthcare industry who have been serving the healthcare industry for years now. My name is Dr. Ruchika Gambhir from Team VOH, and my guest speaker for today is a renowned leader in the healthcare industry, Colonel Rajeev Mannali. Colonel Rajeev is currently the Chief Executive Officer of SUT Hospital, which is a unit of BR Life, which is a healthcare initiative of BRS Ventures Limited. Thank you so much, Colonel Rajeev, for joining us today. Before we
Thank-
dive into the discussion, I would request Colonel Rajeev to introduce himself to our viewers.
That's the toughest part of the interview, I suppose. Uh,
No, sir, with your designation, I think that's the easy part.
okay. Thank you. Pleasure talking to all of you. Pleasure being on the interview with Ruchika and also addressing the listeners wherever they are. Uh, I am, like Ruchika introduced, Colonel Rajeev Mannali. Uh, I had a stint with the Indian Army, which was my biggest fortune in this life. I have served in the Indian Army 33 years plus, and that was a very eventful part of my life so far. One can never forget it. And if there's an opportunity, I would like to be an army officer in the Indian Army once again. Having said this, now I think mostly we are going to talk about my second career, that is being in the healthcare industry. Though I wouldn't like to call it industry in the healthcare sector, let me correct myself. Uh, Post my superannuation in the year 2009, I joined Indo-American Hospital at Vaikam, a remote village in Kerala, as the MD and CEO of Indo-American Hospital. That is a charitable hospital run by a charitable foundation. I was there for 4 years. Then I moved to Vellore. I was with Sri Narayani Hospital and Research Center. I joined that institute on the request of the Madhadipati there, that is, who is known as Shakti Amma. I was greatly inspired by him, and uh, I was there for 2 years. Subsequently, there was a little break where I started something on my own. Hopefully, we'll come to that later. And later, I joined CMC Vellore, Christian Medical College Vellore, which again I think I was very fortunate to have been given that opportunity. I was responsible for opening up their new new branch at Chittoor, that's Andhra Pradesh, about 30 kilometers away from Vellore. Uh, Subsequently, I moved back to, I started missing my grandchildren. So I got back to Kerala, and this time as the executive director of a private medical college in Kerala in the district of Ernakulam. And from there, in 2018, June to be precise, I moved to SUT Hospital. And I have been here since then. This, in brief, or a little more than a brief, is what I have to talk about myself.
Sir, it's actually quite a great professional journey over the years and quite a lot of inspirational things which you have been doing. And on this note, we would really like to discuss more about your journey. As you have yourself mentioned that you have been serving the army for quite a long time, I guess approximately or more than 33 long years, I guess. And then you thought of entering the healthcare sector. So maybe we can discuss about the vision that inspired you to serve the healthcare industry after army.
Uh, I must say that though I was fortunate to have been a cadet in the Sainik School, Trivandrum or Kazhakoottam, as it is pronounced, uh, and from there, after all the UPSC and SSB interviews and all that, joined the National Defence Academy. But all along, I was quite interested in the healthcare activities, healthcare sector. Uh, if, let's say, hypothetically, if I had not joined the National Defence Academy at the age of 17, I possibly would have gone into either IAS or medicine because that interested me really. And I thought that it was a very noble profession to be in. But I think army is a more noble profession comparatively. But
True, sir.
yeah, so therefore, I think I must be extremely grateful to the divinity for having given me the opportunity to be serving in both the sectors, which does on serves the country directly by protecting it, and the other one indirectly, though, but very importantly, looking after the health of its population. So I think uh, there was there definitely was a connect, and I was very fortunate to get an opening, which happened well before my actual retirement. This hospital, Indo-American hospital, had sent out a advertisement wherein I applied. I was shortlisted and selected. So it just happened. I think maybe uh, I'm reminded of that famous secret that if you decide to do something, the whole universe will conspire to make that happen. So maybe I have decided, and the universe actually conspired to make it happen. So that is how uh, nothing has. There was no planning from my end. It just happened. I think it is providence.
So, sir, can we say in the simple terms that you have always inspired to serve the public or the country, and that's how you landed in the defense as well as in the healthcare because you are at the end serving the society?
I think so. I have not really thought about it in that particular tone and tenor. But when you ask me this direct question, I think yes, you are right.
So, that's actually quite a nice journey and something which I guess I could connect to because I have myself entered into the healthcare industry thinking that I want to serve the community. So, moving on, sir, we like to discuss on your vision on the CSR activities. You have been actively involved in the CSR activities, and you even started a consultancy firm, Healthy World, which used to provide consulting services for the CSR activities. So, what inspired you to actively being involved in these activities?
I think there's a little bit of my childhood, my background. Uh, my father was an advocate and a communist leader of yesteryears. So I have seen him involving himself in a lot of activities which were, uh, charitable in every sense of that word. And I've seen growing that. As I've grown up seeing that. So there was always an inspiration at home, and that's my father. Subsequently, in the army, like I had mentioned a little while ago, or I would like to restate that army always carries out a lot of charitable activities wherever it is stationed. You must have, or the viewers must have heard about Operation Sadbhavana, which the army undertakes in the northeast, J&K, and everywhere else they're involved, including in Sri Lanka uh, during the IPKF days. That is definitely an opportunity, or was an opportunity in my case, to get associated with charitable activities, where starting from schooling for the children affected by the internal strife, counterinsurgency operations, and all that, creating healthcare facilities using our own intrinsic uh, organic healthcare facilities, uh, providing food to the needy wherever it's required, helping people even in agriculture wherever that could be done. Actually, it was seamless, making or providing opportunities for the children of affected ages to play games, which otherwise they would not have an opportunity to do so. Volleyball, cricket, football, whatever. So every field, I think the army. This is a lesser known fact about the army's existence. We are all trained, we are all encouraged to do charitable activities in and around the cantonments and wherever you're deployed in counter-insurgency operations. It goes without saying, it is only the degrees vary. If I am more interested, maybe I'll do more. Someone is not that inclined, might do a little less. That's all. But all of us are, as army officers, as commanding officers, and beyond, are involved in these sort of activities, and we encourage our men to do it too. So that is what charitable activities in the army was. So that was another inspiration. Uh, and then I was again fortunate, I think it is Providence, that I was in my second career too, in three of the institutions that I served, including CMC Vellore, which is a great, it's an epitome of charitable activities, I would say it so. Uh, I had an opportunity to be in a charitable surroundings, which helped me immensely. I think that further enhanced my interest in charitable activities. And that is the time when I had a small break of about 6 to 7 months between in my Vellore days, between Srinarayani Hospital and CMC Vellore. Uh, that's the time I started this. I would like to call it an NGO rather than a consultancy firm. The aim was to provide uh, hospitals guidance and also uh, guidance on various aspects, including running the hospital, but more importantly, guiding their charitable activities. That was a very interesting period. I think I could do a lot, but somehow I did not want to continue with this, or I thought that I could merge that with my professional journey also. And uh, I because I wanted to come back to my home state and home town, that is Cochin. That is how I then uh, temporarily wound that up and moved back to Cochin from Vellore. But even now, uh, I think that healthy world and creating a healthy world interests me. A lot of activities I quietly keep doing. For example, while I was in the Indo-American hospital, my first hospital where I served for 4 years, we had started a women's self-help group at Viking. What is the driving force behind this was I had seen that the women there uh, were not really having a income of their own. So we encourage them to come together, work on various aspects like weaving of mats, this, that, and the other. And also we try to help them to uh, ensure that they bring up the children the right way. So all put together, we had a membership of almost 1,000 at that point of time. And I think it firstly brought the women of the village together. Secondly, they had an opportunity to make a living on their own. And thirdly, they would get an opportunity to see, listen, and also get involved in uh, bringing up the children well. That was a very encouraging thing. It was a total success. Then we also started a BCF. BCF was the parent foundation, Babylon Charitable Foundation, a BCF students group or youth group. That was basically to wean the students or the children away from the influence of liquor, drugs, and all that. There was a definitive tendency for children to get afflicted by all these unwanted influences. And we could, in our own small way, get them to play games, get them to get into debating activities, get them to read, because we started a library for them. So all this, I think I gained a lot of self-satisfaction over these activities at that point of time. Uh, that was one. Subsequently, wherever one has been, uh, one has tried to do something for the community, which uh, you know gave them something more than what was currently around. And in all this, I see my role as paying back to the society because the society has been extremely nice and kind to me. So this is my way of returning to the society.
So I guess it's quite a nice initiative which you were working on. And as you have already explained that you were having charitable groups which were promoting children to play, helping them to get out of the drugs and all. So I would like you to give a bit more clarity on or elaborate more on how do you think these CSR activities actually help in improving the healthcare scenario in India?
I think CSR, firstly, I must say that Companies Act of 2013, if I'm not mistaken, specifically provides for and seeks companies which are making a profit to involve in CSR activities. I think that is a very good move made by the government. Now, mandatorily, companies have to spend some money on a part of their earnings from the society into back into the society, which is a very good thing. And there are a set of guidelines given under the same act as to where all you could deploy this amount, uh, which you set apart for CSR activities. So education, healthcare, uh, other activities, agriculture, everything, anything can fall under this ambit of CSR. Under the healthcare sector, there's a lot which you can do. We have seen what NGOs could do during COVID, the epidemic. We have seen what hospitals can do, what public-private cooperation sector cooperation can do. All this we saw pandemic displayed all this potential to us in a very big way. And we had seen the community coming together to help themselves overcome this affliction. So uh, this is the way to go. I think maybe after the pandemic, we have slowed down. We have slowly started pulling back in all these community-oriented activities. In healthcare, I feel there are so many people who are uh, who have a problem, may not have the resources to tackle that problem, and may want help to tackle that problem. That's one area. Hospitals, NGOs can get into that area and provide help to those who deserve it. Secondly, what really one always wonders, what are we doing as a community to prevent diseases? We talk about cure, we talk about curative activities, involvements, and all that. But prevention, it's a good proverb that we always quote: prevention is better than cure. But very little actually is being done to ensure that prevention is the order of the day. When we have, when we call ourselves the world's capital as far as diabetes, heart disease, and the like are concerned, are we doing enough to prevent these diseases? Are we doing enough to correct the lifestyle so people concerned? Or are we just doing lip service to that? So this is something which all of us should think about. When I say all of us, industry leaders, healthcare sector leaders, and also governmental, our own political leaders who handle power, all put together, if we are adequately oriented and focused, I think we can help cure even before cure, prevent prevent diseases. Uh, I think that is the focus which we must take. There are a lot of corporates in that field, but I think more could be done in this field. We could, at the village level, at the uh, uh, taluk district level, do much more to ensure that the lifestyles are not affected, or at least lifestyles are corrected. Uh, to talk about something very simple, uh, making the youngsters, and not only the youngsters, even the middle aged and the old elderly, do some sort of an exercise, maybe yoga, maybe pranayama, maybe anything which they decide to do or are comfortable with or are fond of. If we could get into that activity of making people exercise, I think half our problem is overcome. Then our dietary habits, if we can just go back to our roots and have the food that we used to have before we decided to migrate to pizzas and burgers and all that, I think once again, more than half the problem is won. So, a very focused attention to lifestyle management is what our society requires today, and that is where all of us, the governmental, non governmental, healthcare specifically could get into this act and contribute in a big way in preventing lifestyle diseases.
So I totally agree with you, Colonel Rajiv, because I guess I myself believe that with time, the increase in the prevalence and incidence of these lifestyle disorders is really increasing a lot. So I guess that is the need of the hour to take care of, to look more into the preventive part of the part as well as lifestyle management. So that is really, I totally agree on you, and that is quite a nice way of putting it out. So, Colonel Rajiv, I'd like to know that under an initiative by SUT Hospital, the SUT Hospital has joined the hands with Rotary Club to provide facilities to a rural government LP school. Can you please elaborate a little bit on what this initiative was basically about, and also what other initiatives has SUT Hospital taken to serve the community as well as the society?
That's a very interesting question because Kerala, in Kerala and in India generally, we talk about a Kerala model of poverty alleviation, Kerala model of provision of healthcare, Kerala model of public distribution system, etc., etc. All that is correct, all that is good, but when you go down to the grassroots level, there are still a lot of people who need help. uh, we found that some of the difficult areas, the let me also before saying that state that in Kerala, schools are infrastructurally and otherwise well equipped. But still, there's a lot more which uh, the non-governmental agencies could do to make things better. In this particular school, they had an auditorium. Auditorium was built with part government help, part societal help. But they did not have chairs, benches, and all that to go into that. They were finding it difficult to muster resources for that. That's where we stepped in, along with the Rotary Club of Trivandrum, the oldest club in Rotary Club in Kerala, which is completing 75 years of its service to the nation and the society. We joined hands and provided 40 chairs whereby that could be used either for the classrooms as also in the auditorium and things like that. Plus, we are into providing more facilities for them like library, uh, books, shelves for library books and all things like that. So it is a never-ending thing. There's lots to be done. Even in the best of schools, there is so much more to be done. Play fields, for example. If we could provide play fields for the children, we will have better sportsmen coming out of our society. Where we languish and we lament that India is not doing very well in Olympics and things like that. It Everything has to start at the grassroots level, and the village orientation. There are so many games and sports which we are good at the rural level. To talk about just kabaddi, for example, Coco. All this, if played correctly, we could create champions. We don't have to go after cricket all the time. Let cricket take a rest for some time. We need to focus on other games and sports and all that to bring out more talents and do well in the international sporting arena. There's so much that can be done. Even in a state like Kerala, where we say that we are the best in the country as far as all these parameters are concerned, still there is lots to be done. It is a matter of seeking that out and providing that necessary help, which will bring up the situation. Another example was we found in the tribal areas. Incidentally, I must also make this statement. Tribal areas, because since I've traveled all over the country, I can say with certainty, tribal areas in Kerala are much better off than most of the other tribal areas elsewhere in the country. Even then, there's so much you could still do in a state like Kerala, in tribal areas, in rural areas. All that you need to do is that you need to have a concern, you need to have a focus to be doing something more than what you're otherwise doing, and you can find n number of areas where you can involve yourself and improve the general situation of the locality. So
That
this is
act.
what, yeah,
So please go ahead.
this is what we are doing with Rotary Club, and any other organization that is willing to come forward and join hands with us. We are ready to help them do whatever we can to make that small little improvement in the areas which require that improvement.
Colonel Rajiv, that's actually quite an insightful answer, and very honestly, thinking about the things in a different way, I'll say. While we are about to conclude our discussion, before we part, I would really like Colonel Rajiv to address our viewers, which are basically the young healthcare professionals, that what leadership advice do you have for them? So, what is when you see the kind of young professionals, what is one quality you really wish to see in them to conquer the healthcare industry, I'd say?
I would I would definitely want to see all our healthcare professionals, irrespective of what category they fall into, to see developing more empathy, more compassion. Uh, I think that is where we are lacking. And also, thirdly, I would say communication. I may be a damn good doctor. I'm treatment wise, I'm absolutely fine. But if I cannot communicate well with my patients and the bystanders, if I cannot reassure them, if I cannot give them the requisite hope, then I think 50% I'm not a good doctor. Likewise, a nurse or any healthcare professional in any hospital, be it governmental, non-governmental, there is so much each one of us can do to make to reassure our patients, make them feel comfortable, give them hope. There's no point in
So, you are on mute actually. Please go ahead.
So we have spoken about three essential attributes. One is empathy, compassion, and communication.
Yes.
If we can communicate to our patients, give them hope, and let hope sustain, your medicines can do a lot, your surgeries can do a lot, but beyond all this, and something which plays a very, very important role in making the patients comfortable is talking to them, creating hope in them, help hope sustain, and also be compassionate and empathetic. If these three things are looked into, and in this aspect, every individual employee in a hospital can contribute. You don't have to be a doctor, you don't have to be a nurse, even a cleaning staff member can help, attenders can help. Every possible category of individual working in a hospital can contribute immensely in creating uh, an environment of well-being. And I think that is what matters. So my advice to those listening, the young professionals, irrespective of the category, would be to be empathetic, be compassionate, and be communicative.
Thank you so much, Colonel Rajiv. That would actually inspire quite a lot of young individuals to work into these three domains, which are actually the need of the hour. And with that, I would really like to conclude this session. Thank you so much, Colonel Rajiv, for joining us today. It was a great pleasure to connect with you and listen to your views and inspirations. I am sure that this session is going to help quite a lot of people to step into the industry who are maybe hesitant about it and work in the domain where we actually build a healthy world. Thank you so much, Colonel Rajiv, for joining us today.
Thank you, Ruchika. Thank you very much. And thank you all for the patient hearing. It's been wonderful connecting with you all. Thank you.